For the community or clinical setting portion of the survey, we will be identifying where the sample is collected from. First, we need to discern between community settings and clinical settings. For community settings, think of the word organization or general population. For our religious coping article, the Asian American undergraduate students are recruited from a university, which is a community setting. We would choose university or college setting. Other examples of schools, private, public. It could be from a hospital setting or a doctor's office, a medical setting, a legal criminal setting, either prison, jail, getting some sort of court records, social services, any combination, and other community sample will address anything that's taken from the general population, random digit dialing, sending to random addresses, getting people on a specific list. If there is a named data set in this option taken from a previous study, then we'll name that data set. Now let's go back and look at an example of some of the clinical settings. These are in regards to mental health treatment, counseling, or therapy. So you can have school-based mental health settings, school psychologist in an elementary school, a university clinic. You're going to have a medical or hospital setting different than general patients, ones that are getting treated for mental health, such as from a mental health wing of a hospital or a specific inpatient, outpatient treatment center. Any combination other for anything that doesn't neatly fit. So we'll go ahead and look at examples of some clinical settings. We're going to look at psychotherapists who abstain from personal therapy. Do they practice what they preach? Looking in the abstract, we see authors sampling 119 psychologists, counselors, and clinical social workers. So that's a good indication that this is clinical. If we come down to the methods section, you can see that 700 psychologists, 700 social workers, and 700 counselors are taken from national registers for their occupation. These will be considered a named data set, and we will code it that way. And we will put in all three typed into this box. For our second example, we have therapist and client interactions and motivational interviewing for social anxiety disorder. In the abstract, we see looking at associations between therapist and client speech during a treatment based on motivational interviewing for social anxiety disorder. That's very clearly a mental health clinical setting. Going down to the methods section, we'll see that participants are 85 adults with a primary diagnosis of social anxiety disorder who presented for treatment at the Center for Emotional Health Clinic. McCaker Corey University. So this will be a university or college mental health clinic.